Welcome back. It is time for our weekly Health Matters segment with our friend of the show, Dr. Syed Hussein of Trinity Health of New England. Good morning.
Morning.
Glad to have you here with us. And as usual, we are tackling trending health topics. First off, some researchers found a connection between lung cancer and a healthy diet. It's not what most people would assume is connected. So what exactly did they find?
Yeah, let's peel the layers here because I don't want folks to get alarmed that eating healthy may equate to, a possibly, ominous diagnosis. So there's a study that was recently done which looked at young onset lung cancer. So what does that mean? So traditionally, lung cancer diagnosis has been associated with smoking, strongly associated with smoking, and usually the average age of a diagnosis is in the 70s. However, we've seen a recent trend in more younger folks being diagnosed with lung cancer. Now, this comes on the backdrop of a decline in lung cancer mortality and overall incidence we've seen since the 1980s for men and since the early 2000s for women. However, this subset, though, that we're focused on are individuals that are at 50 years of age or younger that come down with a lung cancer diagnosis. So the study looked at various different elements, including, demographics, diet, use of oral contraceptives. So two things stood out. A healthier diet was associated with a higher rate of lung cancer seen in these people. So what does that mean? It means that there may be other elements related to that diet. So for instance, pesticide use. And for oral contraceptives, the more use of oral contraceptives was associated with a higher incidence of lung cancer too in these individuals. So what does that mean? So there's a certain mutation that's associated with lung cancer called EGFR, which may express more estrogen receptors in women. So, all of these things taken together, what does this mean? Is that we need more research, more studies. There's no causation here. There may be an association at best, but don't want folks to get alarmed. Eating healthy is always good, but make sure where you get your produce from, how it's grown, all of those things need to be looked into and researched more.
Okay, good to know. Next up, we know kids can very easily pick up whatever bug is going around. And right now, rotavirus is going around. It's right. Doctors say it particularly hits babies and kids the hardest. So what do parents need to be on the lookout for?
Yeah, young infants. So there are two approved vaccines that children can get after the age of 2 months of age for a few months. And so that window is important. We've seen an annual decline in vaccination rates. There's a lot of vaccine skepticism as a hesitation generally, and that has led to some of the since the pandemic, we've seen a decrease in children getting immunized. So that is really, really important fundamentally because children have a less of a reservoir to stand up to infection, and they are more susceptible to some of the side effects, including dehydration. That's the biggest worry, right? Which can lead to all sorts of complications in infants. So vomiting, diarrhea, fever, stomach cramps, those are the cardinal features. This is the season where we see rotavirus go up. But compared to last year, same time, it's more incidents that we're seeing of rotavirus. So again, for parents, if your child is in that window for getting immunized, make sure you get them because usually that's what happens. They go to preschool, kindergarten. That's where you see these outbreaks start, and then it just goes on and on.
Yeah, it's kind of like a petri dish.
Yes,
at schools and daycares.
Indeed. But there are things we can do to prevent the spread.
Okay. All right, well, thank you so much for joining us this morning. And as always, if you have any questions, you can shoot us an email and we will ask Dr. Hussein. Back to you.